Hello, and g'day, and welcome to another of our series in the Autism CRC Autism Month webinar series. My name's Andrew Whitehouse, and I'm really lucky enough to be part of the Autism CRC, and I will be, fortunately or unfortunately, your host for today. So we're holding 6 webinars throughout April, which is Autism Month, to improve understanding about autism and to share some of the Autism CRC's latest research around the 3 programs of the early years, school years and adulthood. So this morning's webinar focuses on something that I'm really excited to hear about, and that's health, assessment and diagnosis. So we also have a webinar this afternoon which will discuss our landmark interventions evidence report released late last year. The report summarises and synthesises the best available evidence for interventions for kids that's under 12 on the autism spectrum. On Thursday, we're talking about autism in the workplace, which would be another great one. And on Friday, we have a panel discussion featuring 3 autistic scholars. It's definitely not too late to register, so please do register if these are of interest to you. The webinar series also has featured webinars on writing and transitions, community-led autism research priorities as well. If you missed any of these, don't worry, you can find them on our YouTube channels within the next 4 weeks. So make sure you take a look at that. Alrighty. So before we get started today, I'd like to acknowledge that I'm joining you from the traditional lands. I'm in Perth, so I'm on the Whadjuk people of the Noongar Nation, who are the traditional owners of the land that I'm talking to you from at the moment. I recognise their continuing connection to the land, waters and culture, and pay my respects to the elders past, present and emerging. So for today's webinar, I'd like to let you know that you have the opportunity to submit text questions by typing them into the Q&A panel. That's not the chat panel, that's the Q&A panel, which has the 2 speech bubbles as an icon. If you'd like to send a question in, please do include the name of the presenter who your question is for, and at the end we'll have a question time and I'll be asking the panellists your questions. You can send in your questions at any time, so please do send them in as soon as you have them, and I'll make sure I take a look at them straight away. So on to today's topic, and I'll shut up after this. At Autism CRC, we're lucky enough to focus on building capacity and upskilling clinicians to provide best practice health assessment and diagnostic services to people on the autism spectrum so they can be supported to reach their full potential. Today we've brought together really two experts in this area, and that's Tony Simmons and Aaron Kennedy from Mackay Hospital and Health Services, as well as Dr. Kaia Evans from Telethon Kids Institute and University of Western Australia, to share some of our latest work in the areas of health. So our first presentation today will be from Tony and Dr. Aaron. Tony Simmons is the Integrated Health Manager for Mackay Hospital and Health Service and the Autism CRC project leader for our Health Pathways autism initiatives. Just such a key initiative to help improve and support physical and mental health all throughout the lifespan of people on the autism spectrum. Tony's joined by Dr. Aaron Kennedy, Health Pathways Clinical Editor and Mackay GP. Tony and Aaron are here to tell us what a health pathway is, and it's really important that you do know this, and why specific health pathways for autism are needed and how these pathways will benefit individuals on the spectrum across their lifespan. So without further delay, it really is my great pleasure to welcome Tony and Aaron. So take it away, guys.
Thanks very much, Andrew, and thanks for the introduction. As I said, I'm Aaron and joined with Tony. Similar to Andrew, I'll just start by acknowledging we're in Mackay today, traditional lands in our area, the Yubera people. So I'd like to acknowledge the land that we're on and pay our respects to elders past, present and emerging. I'll just share our screen so that you can see our presentation. As you can see there, this body of work that we're going to introduce to you has had a number of partnerships develop over the course of it, and they're all listed at the bottom there, including the Autism CRC, Mackay Hospital Health Service, where we're both located, the North Queensland Primary Health Network, Mackay Health Pathways, who are also part of Streamliners Group, who are based in New Zealand, University of Queensland and QCIDD. Who've all had input into the development of pathways that we're going to present today. So starting with what we know, we already know that people on the spectrum experience unique health-related needs and may exhibit poorer physical and mental health outcomes in comparison to the general population. Research demonstrates that people with autism have a markedly increased risk of premature mortality. This is just a study that had a big impact on me when we started our research into this project, and also had a big impact on our early participants in our project groups. It's a Swedish study, and it demonstrated that there was a significant risk of premature mortality, up to 20 years in those with low support needs, and even an average of 40 years in those with higher needs. And these were all conditions that could be managed through better preventive care. Additionally, there was a lack of information on how best to support individuals on the spectrum across the lifespan. Australia and New Zealand, we're very privileged to have a long history of specialists in preventive care. We know them as GPs, but autism has likely remained off our collective radar to incorporate those preventive activities, specifically with this patient cohort.
So to take that further in terms of what Aaron was saying, when we first started this research project within an Australian primary healthcare sector, predominantly general practice, there was very limited evidence-based knowledge and understanding of the lifespan healthcare needs of people on the autism spectrum. As a result, we also found that there was a lack of consistent management, limited follow-up for physical, emotional, and oral health needs, limited support for GPs available in a single point or pathway. There was also limited health professional developmental opportunities within the area of autism, especially in regional and remote areas. There was no established or emerging cycle of care, which is a detailed set of patient management steps that a GP can use to support the health management and health assessment of people on the spectrum. And these sorts of management cycles or cycles of care are actually used for other conditions such as diabetes and those sorts of things. So in order to try and fill some of these gaps that we found is where we started the Mackay Health Pathways Autism Initiative. So the aim of the initiative was to try and develop and implement evidence-based clinical pathways for children, adolescents, and adults. So then we had a resource for our health professionals, which gave them the ability to assist in the assessment and management and health and well-being across the entire lifespan. So the first phase of our study actually involved scoping out our local environment, as Aaron had stated. So to do that, we held quite a number of sessions in the beginning, some predominantly with our health professionals and others with support groups, and actually talking to parents, carers, and individuals who identified as being on the autism spectrum. They were given the opportunity to participate in these sessions and education sessions, and also to be involved in completing questionnaires around, for health professionals, their confidence in managing and assessing, and also for carers and adults on the spectrum, their journey that they had whilst going through the whole assessment type phase. Understanding of this sort of information before we started this work was paramount. So then we had an idea of what the actual barriers and enablers were from our health professionals and our consumers' perspectives in the beginning. And the data on the screen quite clearly demonstrates that from our health professionals' perspective, their confidence in assessing and managing was actually quite limited, and a lot of them had very limited education and upskilling in this space as well.
So in order to fill that gap that we identified, we developed this suite of updated and new pathways with a particular focus on post-diagnosis care. So these pathways were the result of over 2 years of work with the partnerships that we had developed. The first two pathways on the list, as far as we know, are the first of their kind and designed to help GPs both anticipate and to meet the ongoing care needs of people on the spectrum after their diagnosis. The other pathways we reviewed and updated primarily from one of our Sydney Health Pathways sites. So we've mentioned Health Pathways a few times now. So what is Health Pathways and why use Health Pathways as a platform for developing this? Health Pathways is an online manual used by clinicians, and the pathways are designed for point of care. So they are very targeted to be used while the clinician is with their patient to help them assess, manage, and make appropriate specialist requests. Rather than being a traditional guideline, each pathway is a local agreement between primary and specialist services on how patients with particular conditions will be managed in the local context. So each health jurisdiction that takes on health pathways do localizations of pathways to reflect local arrangements and opinion, and then deploys that instance of health pathways to their local clinical community. The target audience is primary care, and in particular the GPs in the primary care team. And the aim is to accurately reflect all the healthcare options that a patient can access within that community. Health Pathways has been implemented now in over 40 health jurisdictions. So it's probably got a potential impact on over 48 million people across New Zealand, Australia, and also the UK. Because it's already established as a primary care tool, it makes it much easier to introduce new resources to that community. Because all the pathways are written in a consistent format, clinicians find it much easier then to navigate to the information that they need to help manage their patients.
So once we had all of the pathways finalised and we took them live onto our Health Pathways site to support the go live of the new pathways, we facilitated a symposium event, which is entitled Through Their Eyes, Through Their Lives. We had 4 guest speakers, which came along to discuss various aspects of care needs for people with autism, including a lived experience, and 2 of the presenters were parents of people on the autism spectrum as well. So this event was the first of its kind for our region in terms of education event aimed at general practitioners, and was a half-day free event. And Aaron's just going to switch screens now because during the event is where we also demonstrated the live pathway. So Aaron will now just give a really quick demonstration.
Yeah, so this is the Pathways site that holds all the pathways, and not just around autism, but around sort of every condition that a GP might be wanting to look for. And this is just to demonstrate how a GP might find information to help them manage a patient. So you can see it's got intuitive search built into it. It'll bring up all the pathways that will mention autism, or in this case ASD is what I searched under. I'll just quickly show you the pathway that we developed particularly for autism in adults. Each pathway follows this exact same format, so it becomes really easy for GPs then to navigate to the information that they're looking for. The basic format is an assessment section, a management section, then a summary of all the request points. So from management, any point in management that says request a certain service, they're all summarized in the request section down below. Then there's an information section covering extra information for health professionals, so pointing them in the direction of further education, further reading to further their knowledge if it's an area that they're not familiar with, and also linking into patient resources so that the GP is able to then print those off or direct the patient to websites and those sort of apps so they can access them directly from there. So it's pulling a lot of resources into the one page, including areas like Medicare, how to set up a clinic to make it more accessible for somebody on the spectrum. We try to include all of those sorts of details in the pathway.
So since the go live of the pathways, Health Pathways is attached to Google Analytics, which means that we have the ability to track utilisation and specific page hits to the particular pages. So since the go live, we actually saw quite a significant increase in the utilisation of the Autism Health Pathways. So as you can see on the screen, from July 2019 through to around that October type period, it was around the November, December, January area that we were going to do a big implementation engagement session and go around to each of the general practices. But unfortunately, as we're all aware, January seen us start the COVID-19 pandemic, which obviously quite significantly impacted some of our engagement strategies that we did have planned. We have since seen, though, because obviously from January onwards, the COVID pathways became quite significantly used in health pathways. But just recently, tracking the analytics again, we actually did see another significant spike in utilisation in February, and that was with the child and adolescent pathway, and that could be attributed to school just returning, and obviously GPs needing to get the guidance of that page to look for further assessments. So as I previously mentioned, we were very unfortunate that COVID-19 happened right towards the end of this research piece, which obviously, as I said, impacted our ability to do the final parts of engagement, but it also then affected our ability in terms of the final evaluation as well. So the initial design was set up to do a post-evaluation after implementation to gain some insight from our general practitioners in terms of their confidence post utilising the pathway and how effective the pathways were for assisting and assessing and those sorts of things. So we had to kind of change a little bit of our strategy, but we were able to get 16 health professionals complete a post-pathway evaluation. From that group, there was only one GP that had utilised the pathways who had very positive feedback. But during those sessions, it gave me the opportunity to then demonstrate the pathways to the other health professionals that completed the evaluations, who were actually quite enthusiastic to go back and have further looks. But our post data did demonstrate some very, very similar statistics in our pre-data, and hopefully we would anticipate with better utilisation of the pathways that the confidence levels would actually start to increase.
So finally, where to from here for the pathway? First of all is a rollout to the rest of the Health Pathways community. As I said, it's a very large community. This pathway is being developed in Mackay, but with a view to a very broad uptake across all of Australia and New Zealand. There's already been several teams looking at a localisation of the pathway. Probably the most advanced in that area is Western Australia, who have been through the process of reviewing the pathways with their own local subject matter experts. One of our ongoing tasks in Mackay is just to ensure that any pathway improvements that occur during that process are captured back in the Mackay version. This not only improves our own pathway, but ensures that iterative versions will benefit from those improvements. So any other region that, for example, will localise from Mackay benefits from an improvement that was made in Western Australia. We've got a number of pathway sharing mechanisms in place to facilitate that. The other thing is no pathway is ever set in stone. As I'm sure everyone here is aware, evidence is always expanding and new resources are constantly being developed. So a perpetual challenge for researchers is to translate that evidence to the frontline clinicians where it can be used to make a difference. We hope that this pathway will allow that to speed that process of getting resources to the frontline clinicians so that it can be used to have more impact on patient care. So we're looking forward to sharing this work more widely with our colleagues outside of Mackay. And thank you very much for your time today. And we'll look forward to answering any questions that may have come up during that time. And I'll hand back over to Andrew.
Thank you so much, Aaron, and also to Tony. That was terrific, guys. And you know, hats off to generalists. They have to know so much about so much. And it's really important that there's also support that, and further information that they can access. And that's just the wonderful thing about Health Pathways. And it's even more exciting from my perspective that there is starting to be not saturation, but definitely greater reach of Health Pathways, so we can have coordinated, consistent pathways around Australia. It's just, and the world. It's really terrific. So thanks for that, guys. We'll now move on to our second speaker, or third, but second presentation. Please do, just before we do that, please do continue to throw in your questions into the Q&A bubble. They're the two-speech bubble icon down the bottom, and we'll have plenty of time for questions at the end. I'm really pleased to introduce Dr. Kaia Evans. Kaia is an OT by original training, but now a researcher and lecturer. She's an Autism CRC project leader, program manager at Telethon Kids, and a lecturer at School of Allied Health at the University of Western Australia. Kaia's also the project coordinator, was also the project coordinator of Australia's first national guideline for the assessment and diagnosis of autism, which was released in late 2018. And having played a small role in that myself, I have to say that Kaia was really the heart and soul behind that. So Kaia, please do ask any questions about that as well. Today, Kaia will be talking to you about the work that's been happening since the release of the National Guideline to ensure its recommendations are implemented by clinicians and health professionals across the country. It's going to be really interesting to see. Thanks, Kaia. Take it away.
Thank you. Fantastic. Thank you everyone for coming along today. I would also like to acknowledge that I'm also on Noongar land over here in Perth, and pay my acknowledgements to the elders past, present and emerging. So today I would like to talk about the National Guideline Implementation Toolkit, which is one of our big projects that we have worked on since the guideline. And time permitting, I'll also talk about some of the other implementation activities we have undertaken. So when we published the guideline back in 2018, in two of the documents that we released at the time, so the main guideline had a section at the end called practice points. So they were activities that we were recommending to occur beyond the assessment and diagnostic process. And today, particularly, I will be talking about our recommendations for dissemination of the guideline. We also had another supporting document that some of you may be familiar with, which is the administrative and technical report. And we had a dissemination plan that we outlined there. Some of the activities that we indicated that we would like to focus on were producing some fact sheets and explainer videos, and also a self-evaluation checklist for clinical services. We were very fortunate that the Autism CRC was able to negotiate a collaboration with the Department of Social Services, and that allowed us to develop an implementation toolkit. And there were 4 components that we were contracted to deliver as part of that. There was a website, a series of fact sheets, a series of explainer videos, and a baseline evaluation and audit tool. So I'll take you through and introduce you to each of those resources in a moment. So they were delivered just over 2 years after the original guideline in December 2020. In terms of the team that developed those, there was a combination of the marketing and communications team at Autism CRC and several of us at Telethon Kids Institute. So I've just got Kelly, Sally, Jason and Liz from the CRC, and myself and Andrew at Telethon Kids. We also, as part of the process, had some community input. So we had a member of the autism community and an autistic adult who is also a parent of a child on the autism spectrum, involved in the process of developing the resources designed for autistic adults and caregivers. And we also accessed some of the clinical community at Kids, which is part of the Telethon Kids Institute. Particularly, we had input from allied health professionals from speech pathology, clinical psychology and occupational therapy backgrounds. And they provided input on the clinician-focused tools. So I thought what I would do is just provide a bit of an introduction as to what is on there and the types of features. So the website has three main pages associated with it. So I'll go through each of the three. The first one you can see the top area, the top circle that I've got there on the left is the guideline. And this is where you're able to enter in your email address that you've previously registered with the Autism CRC to be able to access the National Guideline documentation. So I've just got some examples of, there's a little bit of an administrative process, but that's in place so that we can have good web metrics of what people are accessing so that we can ensure that future resources that we develop are in line with what clinicians are interested in. And it also means that we can capture some information about who is accessing the guideline and make sure that we've got contact details so that when there's updates, we can let our community of clinicians know. So there's a few steps here on the left-hand side to guide you through. And then you've got on the, here we've got circled the National Guideline. There's also the implementation toolkit on the other side. So that allows you to go through to the original documents that were published in 2018, and the implementation toolkit allows you to go straight to the recent additional documents. And then you can see at the side, there's different links for the different documents. The next tab on the website is for the community. So we can see here on the left that there are resources aimed at parents and caregivers, and also resources aimed for adults who are undergoing an assessment. Along with links to the resources, there's also some frequently asked questions. So you just click on each of those and it opens up the text underneath those. And once you click through to either the parents or the adult services, you can see here that there's similar but slightly different information on each of those. You can either click on the play button to watch the video, or you can, as illustrated here, you can click onto the small image of the fact sheet and go straight through to that. We then have the third tab, which is the clinician resources. So we've got information about learning resources. So that's where we've got the fact sheets and the videos that you can click through to using the same format as on the previous slide. There's also the implementation tool. So that's where you can get the baseline evaluation and audit tool, all the different templates and forms that were published with the original guideline. And then there's a little bit more information drawn out from the guideline around the training requirements and expertise required to undertake autism-related assessments. So that's the website. So as you drill through to that, as I mentioned, there's the fact sheet. So we have 2 community fact sheets for adults and parents and caregivers, and we also have 6 versions for clinicians. So the clinicians versions go into a little bit more detail, and what we've done there is divided the guideline into 6 sections of grouped according to topic. So we have some background information about called setting a national standard. We then have the 6 guiding principles detailed. It then goes on to explaining the assessment process and how the components fit together, and then separate fact sheets each on the comprehensive needs assessment, which consists of assessment of functioning and a medical evaluation, and then the diagnostic evaluation, commencing with a single clinician, and then if required, going on to a consensus team diagnosis. The final fact sheet is around the important considerations so that the assessment process can be tailored to the individual and their circumstances. With the fact sheets, we focused on keeping them quite brief as an introduction to the guideline, so they're all ranging between 2 to 3 pages. We can see here some of the features that are common across the guidelines. So on the left, just highlighting that there's text content, and what we've aimed to do is, whilst preserving the rigour and the intention of the recommendations, simplifying the language to make it more accessible for a quick read. We also have, as we can see here, quotes and key text popping out with the green formatting. We have some photographs to illustrate points. We have flow diagrams to explain processes, and then we've got certain icons to represent particular topics, just to make the content easily accessible so that the reader can rapidly understand the content and be engaged in the process. We also have a corresponding explainer video for each of the fact sheet. So again, 2 community and 6 clinician versions on the same topics, and they all range between 4 and 5 minutes. And we've got several different features that we've used in there. So sometimes we have this navy background with some images to the side and Andrew talking. We also sometimes have some illustrations throughout the video, either in more this animated colour version or in silhouette format to help to illustrate the points. Sometimes we use a variety of icons to get across the information along with brief text points. And then at the end, we've got further information and links so that people know what they can access next. The final output is the baseline evaluation and audit tool, and that's available for clinicians to use as an Excel document. And our intention around that is for individuals or teams to, before they commence implementing the National Guideline, to have a look at what they're doing already. So we have a front page here where we have some data that feeds through from other aspects in the other worksheets in the file to give an overall snapshot in terms of where people are up to, in terms of how many recommendations they're currently adhering to, and we also have a snapshot of their current status. We then have a series, hopefully you can see that in the image, a series of tabs for each of the different sections of recommendations. At the top, we have some summary statistics that pull through from the spreadsheet. And what we have there is clinicians can go through and provide a rating using the drop down of their current adherence with the recommendation, each of the recommendations in turn. They can make some notes about their current status, talk about actions that they would like to take, and allocate an internal deadline and who is responsible. So it becomes a project management tool that later on down the track they can come back to and audit how they've improved over time. So what sort of impact have we seen from the tools? So as I mentioned earlier, the tools were released on the 9th of December. So this graph at the top tells a really nice story. We can see these are the downloads of the guideline after its original release. So we can see in the first few days there was a rapid increase, then we've got a steady growth over the 2 years or so after it was published. And then we have a nice little upkick at the end that shows the increase in downloads to the guideline after the implementation toolkit was released. One of the stats that we look at is during that steady period there, we were looking at about 11 registrations for the guideline per day, and that jumped to 21 per day after the toolkit was launched. One of the exciting things to see is it wasn't just people who had already downloaded the guideline that were accessing the toolkit. We actually saw over 1,500 new contacts to the Autism CRC database after the toolkit was released. So that's a really positive indication that presenting the information in a more accessible way has allowed a greater range of people to access information about the guideline. There's been over 10,000 accesses to the guideline resources since then. Each of the different pages looking at around 300 to 800 views since the release, and well over 1,000 downloads of the baseline evaluation and audit tool. We can see the pie graph on the side shows that the most popular resources have been around caregivers, followed by autistic adult resources, and then we have the assessment process being the next most popular, but also across the board there's been a relatively good interest in all of the resources. We've also had some anecdotal feedback from people who have accessed the resources, and that's been really positive as well. So I'll just check in with how I'm going against my time. So I'm actually at time for the presentation. Did you, Andrew and Kelly, did you want me to talk about any of the other things, or just, oh, Kelly has sent me a text message.
Keep going, Kaia.
Keep going? Okay, so I'll just talk very briefly through the other implementation activities. Each would be a presentation in their own. So in terms of the original dissemination, other things that we did right at the beginning was release web resources such as case studies, templates, layperson descriptions, and the evidence tables, and we had our official launch at Parliament House. Since then, we've been involved with the NHMRC, so we've got a case study on the NHMRC website, which I think after the TB research case study, I think it's the second most downloaded one on their site now. We've conducted a national research study where we looked at looking at the reliability and validity along with consumer acceptability and clinical utility of two standardised assessment of functioning tools, so the PediCat ASD and the Vineland 3. The University Graduate Certificate of Autism Diagnosis has been fully integrated the guideline has been fully integrated into the content, and it was really nice to see in the Health Pathways in the first presentation today that that our resources are also integrated into that too. We've got several PhD projects with University of WA and Curtin University underway at the moment. So we have a NIN looking at the adherence with the guideline recommendations along with the facilitators and barriers to implementing those, and that's due to, we're hoping that that will be submitted to a journal mid this year. We also have Emily and Maya at Curtin University looking at self-caregiver reported and clinician administered assessment tools based on the World Health Organization's International Classification of Functioning, Health and Disability. So that they are set up to align with the National Guideline recommendations. Future things that we're hoping to be involved with. So DSS has set up an expert reference group with the various different colleges and associations. And over time, we're hoping that that will translate into clinical training networks and accreditation programs for clinicians involved in the process. In the guideline, we advocated for funding for neurodevelopmental assessments. So we're hoping that over time that, that government funding will be available for the various different aspects of the assessment process so that they can comprehensively and consistently be applied across the different systems. And we're also working on a range of journal articles that will come out over time. The last one here is some work that I'm hoping that we can do in the future with the Australian National University, looking at evaluating the implementation of the guideline in terms of how that impacts on practice. So that's the end. So I will stop sharing my screen and send things back to Andrew.
Hello. All right. Thank you so much, Kaia. And I'll ask Tony and Aaron to pop back on. Look, thank you for two fabulous presentations. I was just thinking just then, I think probably the common theme amongst them is the notion of the importance of consistency, of transparency and pathways in providing optimal health medical support. Well, health and medical care and support for families and individuals on the autism spectrum. It's absolutely critical. And historically in Australia, due to our beautiful federation, we haven't necessarily had those kind of consistencies. And this kind of work that Kaia and Tony and Aaron have described is not glamorous by any stretch. In fact, it's bloody hard. And I just thank God, it's just terrific that they have done that and rolled their sleeves up and really got down into the mud. So it's really, really impactful research. What I'll do now is go on to some of the questions. So first one's going to go to Aaron and Tony. It's really about, in fact, I'll do two back to back. The first one is around, does the Healthways Pathways portal include anything about how individuals might be able to access the NDIS service? I might ask if you could answer that one first up.
Sure, I'll jump into that one, and I'll probably just share my screen as well, because then I can show where it is on the pathway.
Oh, terrific.
This is in the children's pathway, so as part of the early on in the management steps. Sorry, I'll get rid of these questions here. There's a drop-down section here on healthcare funding support, just included as a bit of a summary point of these are all the different sort of funding that is available. This symbol indicates that it's going to link out to an external resource. These ones, though, are an internal resource. So when the clinician clicks on that, it gives them that summary page of this is how you access the NDIS or the early childhood, early intervention scheme, or whatever the funding criteria is. The other ones were around GP funding for chronic disease management items, better access to mental health care. So it kind of pulls all of those together into that one place.
And just to be a little bit more specific as well, in terms of the actual registered NDIS providers, we don't actually go through and list every single one of those, because obviously to try and keep up with the people that are providing the services and that sort of stuff is quite time consuming. So we do very much rely on the NDIS side and that list being up to date as well. So our health professionals can keep the most up-to-date information from those external sources, but rather than having to try and search for them, we've given them the exact links to try and get exactly what they're looking for.
It was also a really good question, because I did go through the adult pathway and couldn't find it. And this is a good opportunity to let people know that there's a send feedback button linked to every page. So when a clinician comes across something, so any of our allied health or anybody goes, actually, Aaron hasn't included this important bit of information, they can just press that button and it'll come to us so that we can then do a review, include that information on the pathway. And that might just be simple things like a phone number has changed, or a website, or a service is closed down or moved, whatever it is. So I'll send myself some feedback and we'll add that to that pathway as well today.
Terrific, terrific. I love the notion that you can send yourself feedback. That's great. Look, I think that just automatically that sort of emphasises the challenges that we have in between two different systems, a health system and a disability system. And while we're not tackling the federalist sort of argument in between those two, but nevertheless they are challenging. And it's really terrific that the work of Tony and Aaron and others, Sue, Olivia, I know some people in Western Australia who are fabulous at doing this kind of stuff, is really trying to bridge it from the health side. While you're going, Tony and Aaron, can I just throw to another question around who actually can access health pathways? We've had a couple of questions around that. Yeah. And so it'd be lovely if you could answer that one, please.
Yep. So when each health pathway site is starting up with health pathways, the information that comes from Streamliners, it does sort of say anyone who's a registered health professional, so anyone with an ARPA registration. I guess for us in Mackay, we kind of swayed that a little bit, because that can be a little bit of a, you can either be very black and white with it, or you can be a little bit grey, and we decided to be a little bit grey. So we extended some of our access out to some of our health workers, because they may not necessarily be registered with an APRA registration, but they're still assisting in the care. And then I also provided access to some of our school guidance counsellors and officers, because again, a lot of those do have a health professional background in terms of counselling or some type of health or allied health type background. So it really comes down to the health jurisdiction of where Health Pathways is. Some will keep it very black and white to purely registered health professionals, or you may find some areas that, based on some of the projects that they do, they may actually blur some of those lines. So we did do that in terms of mental health, health workers, Aboriginal health workers, and then we opened up to schools as part of this, our child developmental stuff. And then when we went into the autism work as well, we just seen that it was quite beneficial to really cut those lines and make it a little bit blurred.
Yeah, but the GPs, the sort of, it's kind of terms the target audience, but that's really to give the how we write the pathways a clear focus, so that it's clear sort of who we're writing for. But it is treating the GP as one end of the entire community sort of health pathway team. I suspect a lot of our users are practice nurses doing, being involved in care planning and those sort of aspects as well. So we pretty much open it up. If you're involved in healthcare in the Mackay region, you should have access to Health Pathways.
So even the acute and tertiary type sectors, so the hospitals, mental health units, so everybody in the Mackay region that had health associated all were given access. And it's really interesting because streamliners are now starting to look at deploying a new product, which is called Hospital Health Pathways. So if that does see some traction in the future, you would start to see tertiary health pathways linking in with community health pathways, and you would start to see the two sort of working in unison to try and fill that gap and bridge the differences between acute care and secondary care, which is another massive issue, especially when we're talking about autism spectrum disorder.
Yeah, and so they sort of answered another question there by Stacey. Hi, Stacey. Around can this is being rolled out within tertiary healthcare settings, particularly public mental health settings?
Yeah, it's not so much the so they'll have access to what we term community health pathways, but there is a sort of parallel program that can be run at the same time, which is hospital health pathways. And it's run in parallel so that it makes sure that, for example, if I was developing a pathway for autism in the community, you also develop one for autism in tertiary care at the same time, so that all the connections make sense both into the tertiary system and back out into the community. So there's an agreement on how we're going to do that within a local context. So hospital health pathways has been is already rolled out in Canterbury in New Zealand, which is where Health Pathways kicked off. But there's a couple of sites in Australia as well, Hunt, New England. I can't remember the other ones. There's a couple of sites that are trialling it at the moment, and other sites looking at it. I think that's a great question from Stacey, because it's really that big picture thinking of how do we connect all of this together, which is I think is really exciting.
Yeah, and just to make it really explicit, so non-health professionals can't access health pathways, and I'm assuming that's because the system has been designed to be used in conjunction with a trained health professional. Is that correct? Yeah,
that's right. Interestingly, in the sort of Canterbury experience, because they've had the longest experience with health pathways, patients now, I've had sort of reports from clinicians where the patients will, for the GP struggling a bit with helping them with a particular issue, the patients are actually prompting them and say, well, what does the pathway say about it? Because there's a community knowledge of the health pathways as well. So they're saying, well, you've got a resource that helps you to answer my question. Have you looked at it?
And I guess it'd be nice, big sky thinking as well, for us to really look at, if we do get like a community in a hospital, to eventually to have a consumer type version as well. So then me as an individual could potentially go on and navigate my healthcare as well, because as we know, people are becoming more technology savvy and taking charge of their health and really want to try and navigate that themselves. So in the future, I do potentially see like a consumer health pathways, potentially if someone wants to take that on.
Yeah, yeah, absolutely. Look, I've come to the conclusion that pathways are absolutely everything. I used to think it was boring. It's very sexy now. I think it's absolutely how you support families. Just one question for Tony before we switch to Kaia. Tony, I know you've seen a comment around that there is a difference between the parent's perspective and the lived experience. And did you want to have a chat about that?
Yeah, I just wanted to just acknowledge that I did read the comment, and I just wanted to apologise in the time constraints of the presentation that the full information I may not have portrayed it in the way that I potentially wanted to. So I'm also a parent, so of a child. So I completely do understand that my experience and my child's experience are completely different. So to expand, I guess, on the lived experience aspects of the symposium, even though Anne was the parent, her adult child had actually developed the PowerPoint presentation and developed all of the photos and did all of the wording. He just didn't feel comfortable presenting to a health professional audience. So he'd asked his mum to do the presentation on his behalf. And then our other presenter was a lived experience as a father, but then also incorporated videos from his son as well. So we did have the two different perspectives, and we did acknowledge that Anne's presentation, she was doing on behalf of her child. And when we did the questionnaires, we did try and get a selection of not just carers and parents, but we definitely, and we were successfully managed to get two adults on the spectrum to provide input to those questionnaires. So thank you very much for bringing that to my attention and for giving me the ability to expand a little bit further on that section of the presentation.
Fantastic, Tony. Thanks for that answer, and thank you to you both for answering those questions as well. Kaia, I might throw to you now for a few questions on your presentation. One question we've had is the guideline outlines a really great process. There's no doubt about that, and it was co-developed and co-designed with the autistic and autism communities, clinical communities, and policymakers. It outlines an ideal process. What are some of the barriers to the uptake? You're certainly through your presentation highlighting some of the ways that awareness can be raised. What are the other barriers that you found through either your research or through this process?
Sure. So look, I think one of the barriers Andrew mentioned earlier around the states coming from different health and disability backgrounds with federations. So we're starting to see a little bit more consistency happening nationally, but there's still long established processes. And very much when we were developing the guideline, we travelled around and held workshops in each of the states. Apart from ACT, we didn't quite make it to ACT, but we did have attendees from ACT at our Sydney workshop. It was a completely, each workshop had a very different mood and feel and the type of feedback that people were providing. So I think that is one of the barriers. So for clinicians in one location, it might feel really challenging for them to find out how they're going to do all of these extra things. Whereas in other locations, there might be fear that the guideline is asking them to do less than that they've been doing. So I think that change management process, we did, when developing the guideline, tried to embed as much flexibility in there with the underlying premise that it should be guided by the individual's needs. So I think that will help. I think that the future projects that DSS is looking at doing with each of the different disciplines involved with assessment will potentially help. I think one of the other barriers is around funding models. So at the moment, the funding model is not designed to match the guideline. Even simple things in terms of the order in which the Medicare assessment item is going to be triggered, adult diagnosis, there are huge gaps in terms of the process there to bring that on board. So I think that there's some longer term barriers that need to be overcome.
Yeah.
But yeah, certainly in the short term, I think that clinical communities and one of the big focuses in the guideline is around peer-to-peer learning. So I think as clinical communities within teams, within cities, within professional groups develop, and some people have some success with the guideline and are able to work with their colleagues to show what the successful elements were. I think that will help as well.
Yeah, thanks. What a fabulous answer. And I mean, if I could just add, look, I completely agree that that the historical roots of how health and medicine and disability collided through state-based systems is a challenge here. I would also put out a bit of a call to arms to everyone, where we do have a protocol, an assessment and diagnostic protocol that's been endorsed by the vast majority of stakeholders, and so while we have entrenched structures that may not align with that, we need to ask ourselves, what do we feel do we demand the same levels of evidence and care that we would demand of other areas? And if so, then we need to redesign our structures. And I think that's a really key point to both government, but also to local providers, as to, historical and traditions are not enough. Best evidence is really what we should demand as well. Look, that's come to the end of our question and answer time. And I just really wanted to thank once again Tony, Aaron and Kaia, not just for sharing their time, but also for sharing some really hard grinding work with us. This isn't glamorous, this is the stuff that changes lives. And I do want to thank them and for presenting it in a way that was really understandable for all of us, me included. Really like to also thank you, the listeners, for taking your time. Finding an hour is not easy in anyone's life, and we really do appreciate it. We do appreciate if you could fill in a survey that's been shared in the chat. That really helps us to improve how we deliver these in the future, because you are our audience. We do this for you, and we really want to make sure we know how to do it. This year's webinar series has been extremely popular, with more than 2,000 registrations across 6 sessions. That's terrific. If you'd like to share today's webinar, we'll be placing a recording of the session on our YouTube channel. We'll share the recording on our website, as well as through our social media channels, Facebook, Twitter, within the next 4 weeks. If you'd like to know anything more about the CRC's work across the lifespan, please do visit the website, where you can sign up for our e-news and participate in some of our studies. You can also follow us on social media. So that's it for now. We're at the top of the hour, or half past if you're in Central Time. We really do appreciate your time, and please do join us again for more of our webinars. Thank you.
Thank you very much.